came about as a neat little idea from the CMO, then ex-CMO David Grayson, who brought it to us and said, I've had this call from Tom, who's got this neat little idea of giving ED access to patient information held in the GP practices, and so it began.
Often patients presenting to the emergency department have no recollection or limited recollection of what medications they're on or changes to medication, and sometimes they're too sick or unwell to be able to give us that information. After hours, this creates significant difficulties because often the general practitioner's offices are closed or the pharmacy may be closed, and so we really have little idea about what current medication or current medical problems the patient has. CareInsight has been significantly improved our access to health information about these sort of patients. We're able to access a list of current medications and prescriptions and a list of recent and past medical problems on many patients presenting to the emergency department. And this allows us to have more information to make the right decisions about patient management.
The information that it gives you often, certainly at that time of the day, is you can't obtain it anywhere else. And I would say in a few cases it has kind of revolutionised as a patient's care, and I think it really has helped my practice.
As an example, we had a patient who presented with a polypharmacy overdose after hours in the emergency department. And the patient was too sedated to give us any information at all. We had no record from previous hospital visits as to what medication that patient was on, and we weren't able to contact their GP or have any knowledge about what their normal pharmacy was. Using CareInsight, we were able to quickly obtain a list of current medications and work out the likely drug that was involved in the overdose. So it made a significant difference to the management of that patient. And there have been numerous other examples as well.
Going on to kind of the medical side of things, the transition that I've made, I've found it equally as useful. Certainly, again, when you're out of hours and able to get that information from GPs or pharmacies, it really has been vital, you know, especially with all the media attention at the moment about having continuation of medications and the continuation of care, and that being a big factor in morbidity and mortality, in that there is sometimes medications and drugs missed off the charts. Having that information easily accessible out of hours is vital for continuation of that. Patients
have been pretty happy about us being able to access their health information electronically. Often, particularly elderly patients come into hospital and find it really hard to recall all of their medications. We can say to them, look, we can go away using a computer, we can get a list of medications from your GP, and that'll give us a full list and we'll know exactly what you're on. And they're thrilled about that because it kind of takes the pressure off them to have to remember what all their medications were or carry a list around with them. Another thing that plays quite an important role in is the trust between patient and doctor, obviously, is vital to their care. And I think that often it is assumed that records are passed between hospital and doctor and hospital and GP practice. And I think sometimes when you go to see a patient who hasn't necessarily been into hospital before and you're not aware of the things that has happened in their past or the medications, they can sometimes see that as kind of an incompetence thing or a non-trust thing in the system. And I think having a system which most people assume should be there actually helps with their confidence within the medical profession as well.
From an IA's perspective, I think the key measure of the success of CareInsight is that it's being used every day. So we have a daily report that gets sent out by HealthLink telling us how many times CareInsight has been used, and it's almost at least once or twice every day it's being used by the doctors to look up a patient information. So I think from a technical perspective, that's a measure of success.
I strongly recommend it. I think it's a brilliant system.